Good afternoon, North Dakota. Thanks for tuning in. We got a lot of topics today, and we have a couple of guests today. Chief Justice John Jensen will be here, we've got a guest, Garth Ryland, President and CEO of Valley Senior Living, will be joining us by phone, and Chris Jones, the DHS Executive Director, will be here for questions. Before we jump into our full program of information, got a very important announcement to make, and that is happy birthday to the First Lady of North Dakota, Catherine. Just want to say to everybody that is listening today that I got it up close and direct view to be able to see that how fortunate and how grateful we are as a state to have this amazing individual as our First Lady right now. The courage that she's shown to help all those who are struggling with the disease of addiction has been really amazing. The great work that she's done reaching out to communities and the tribal nations in our state, really been incredible. And I just say for those that only get a glimpse of her once in a while, I'll give you a firsthand testimony. She's doing amazing work on behalf of all of us, and not doing it just here, but also really helping change policies and perceptions on a national level as well, and the federal level. So again, just really grateful for all the work that she's doing, and delighted that she's having another happy, healthy recovery. This is her real birthday, but had her 18th recovery birthday earlier this year, so lots to celebrate in our family. Congratulations, Catherine. Next topic, we want to jump right into the numbers. Today we had 40 additional cases of positive tests out of 2,624 tests, or 1.5% rate. This continues the great string we've had of very low percent positives. And again, so thanks to everybody that's making this happen. This is a testimony to everybody in North Dakota, not just those on the healthcare side, but everybody for all the great work they're doing. We've now completed in total 107,509 tests have been completed. That's 76,856 unique North Dakotans. That puts us, again, stays in the top 5. We're just behind Rhode Island, New York, New Mexico, very close to New Mexico in that per capita testing. And of course, the reason we're doing all that testing is that's a way for us, that's the path for us to get our economy going full steam, because that allows us to protect lives and livelihoods. It allows us to be precise on who needs to stay isolated to prevent the spread, and who can get out and enjoy work and life. And so again, testing is a big tool for us. When we also are, of course, doing testing, particularly we do a lot of testing, of serial testing for people in healthcare, people that as part of their job may be regularly coming in contact with people who are positive. And today's tests that we conducted today had over 1,112 newly tested North Dakotans, people for the very first time, and a majority, 1,512 of those, were people who had been tested prior than that. When we take a look at the net case breakdown, 33 newly recovered cases, but sadly, five deaths. The 432 active cases is part of a good trend line that has continued to go down. We'll take a look at that in a second. But on the deaths, I want to just say, yesterday, we reported no deaths from the prior day. Today, this is a 24-hour period covering yesterday, Thursday. We had a man in his 90s from Cass County, a man in his 80s from Cass County, a woman in her 80s from Cass County, a woman in her 70s from Cass County, and all 4 of those with underlying health conditions. And for the first time out of 71 deaths, we had an individual which was reported of dying with COVID-19 who had no underlying health conditions, and this was a man in his 60s from Grand Forks County. But for those 5 families who've lost a loved one, from the First Lady and myself, again, our thoughts and prayers and condolences go out to you and all those who've lost someone during this COVID pandemic. As just we'll jump into the cases for a second on the cases trending down here. You can see again with these 432 cases is where we're at today. That's one tick up from yesterday, but again, great trend line down over the last 2 weeks. And that again mirrors the next slide, the rolling average tests, again, where you can see that Cass County in the top really coming down nicely, and as the state trending down. This is the rolling last 14 days, but as those numbers tend to track down, reflecting the great string of positive days under 2% that we've had over the last week. So really positive direction here. And I should say those are positive direction, but they're also relative to almost every other state in the nation are much lower and than every place else. Again, when we're talking about rates coming down into this 1 to 3%, understand during the height of the pandemic in states like New York and New Jersey, even in Louisiana, after the outbreak that they had down there, post Mardi Gras, that there was a time when they were testing over 40% of the people were testing positive, something we were fortunate to not see here. But again, great work by everybody that these rates are coming down. And again, when we take a look at the net case breakdowns, again, when we take a look at the 71 deaths, I want to just share a few more thoughts on that. Again, of the 85% of the total, or 60 out of the 71 deaths, are people that were age 70 or older. And if you're 20, you probably think, hey, 70 would be great. But if you're 70, these days, you might say, hey, I've got a lot of life left in me. But those that died, the 85% age 70 or older that have passed away, which would be 60 out of the 71, were all individuals that had underlying health conditions. You hear us talk a lot every day about about protecting the most vulnerable, and some people might say, why all the focus, or COVID isn't a big risk. Why are we taking all? Why all the concern? But I want to just break it down a little bit again on the for those that have passed with COVID in North Dakota. Those that are over people between 70 and 79, we had 106 positive cases. 15 of those resulted in death. That's a 14% death rate. For those that are in their 80s or older, we had 186 cases, and 45% of those individuals passed, or 24%. And so when we talk about protecting our loved ones, if you've got someone who's in their 70s or 80s, and particularly if they're in congregate living and long-term care, and if you're you think that at least even the percent, these are the percents are for North Dakotans. If you go to other states and even neighboring states, these percentage rates of those that pass with COVID are even higher. But if you thought that your loved one had a 14% chance in their 70s, or a 24% chance if they're in their 80s of passing away, you probably would also be saying, hey, what are we doing to protect those that are most vulnerable? And there's a great quote I'd like to share from Mahatma Gandhi. He said it in 1931, but he said that a true measure of any society can be found by how it treats its most vulnerable members. And this is why, since the very start here, we in North Dakota, we have been focusing on those that are most vulnerable. And we know that there's been a great amount of effort. We formalized that through the work that we're doing with the Vulnerable Population Protection Plan, the VP3 plan. But I also want to just take a minute and walk through a couple slides relating to people with underlying health conditions. Because again, when we've got today, the first time we had someone pass away without underlying health conditions, but the 70 out of the 71 have, what does that actually mean? It can mean chronic lung disease, moderate to severe asthma, people with past heart conditions, people who are immunocompromised, severe obesity, obesity, diabetes, chronic kidney disease, people undergoing dialysis, people with liver disease, people who've had transplants that may have compromised immuno systems as well. So those are all things that would fall into this area. And of course, people with respiratory, upper respiratory diseases and others, if you've got lung cancer or something like this that you think, these are all certainly challenges if you get COVID. But we also there's several ways that people at higher risk can reduce their risk of getting sick, and these are some common sense things. Of course, again, continue your medications. Don't change your treatment plan without talking to your doctor. Make sure you've got several weeks supply of prescriptions. Talk to your healthcare providers, your insurers, your pharmacists to make sure that you have got what you need or to reduce trips to the pharmacy, and talk to your healthcare provider about whether your vaccinations are up to date, because if you've got underlying health conditions, you don't want to get COVID, you don't want to get anything else that could be prevented by a vaccination. And of course, one of the key things, we know that some people made choices about delaying their emergency care because of their concern about COVID. But again, when we talk about hospitalizations, we're down now on hospitalizations to a very low level, and of those that are hospitalized, out of that 30, only 8 of those are in ICU. So we've got great health care in North Dakota, and we've got great capacity for those people that need care at the highest level. And so again, do not delay getting the care you need for these underlying risks that you may have, and again, contact your healthcare provider if you've got any concerns, or if you're getting sick for any reason, or you think you may have COVID-19. And of course, if it's a real emergency, just call 911. Today we're going to be moving to the next topic. We're going to be talking about long-term care facilities and updates, and updating one executive order related to that. And today's announcement we're making is related to visitation at long-term care facilities, which includes all 3 levels: skilled nursing, which is something that people know about all over the country; basic care, which is something unique to North Dakota, which is paid for by the state of North Dakota; and assisted living. And as you recall, one of the things we did early on in this crisis, which we know has helped save lives, has been to suspend visitation to long-term care facilities. We did that on April 6th. On April 21st, we released our North Dakota, our ND SMART VP3, the Vulnerable Population Protection Plan, to ensure that hospitals, long-term care facilities, intermediate care, other congregate facilities had the resources to prepare and handle COVID-19. And that VP3 plan also covered other places where we had vulnerable populations, including homeless shelters, developmentally disability group homes, and domestic violence shelters. This afternoon, I signed an executive order modifying restrictions on our visitation to long-term care facilities, which again will allow them to resume in a phased approach based on the factors outlined in the VP3 plan. We shared on last Friday, Chris Jones did, that we were heading in this direction, and this formalizes that again in this modification, because in that executive order back on April 6th, we had suspended visitation. This modification allows us to begin that phased reopening plan. One thing I do want to make sure that everybody understands that we're also announcing today, and we've taken a look at what other states have considered doing, some that have just started doing. We want to be on the front end because we are all about reuniting people with their loved ones. We know the stress and strain of isolation is real. We know that it's got an effect on behavioral health. We know that connection with loved ones is one of the things that helps improve health. And so Chris Jones, myself, and the entire team here are completely and totally committed to making sure that we can reconnect people with their loved ones. But we're also totally committed to protecting all those individuals in congregate care, because as I walk through the numbers, you can see when we've got 74% of the deaths that we've had in the entire state have occurred in long-term care facilities, we want to make sure that we're protecting those individuals in those facilities who've got many years left to live. We want to make sure that that they and the workers that work there are all safe. So one thing that we're announcing today, and this is that we're strongly supporting the commencement of outdoor visitation with some caveats. So and this will be up to the facility management, but a facility management can provide clean masks, appropriate social distancing, do it by appointment, and provide a safe location. And by safe location, we'd like to mean some outdoor location that's, say, not the parking lot or not a place where safe both in terms of physical, but also safe in terms of potential spread of contagion. Then as soon as the facilities have these plans for outdoor visitation, that can occur. And so again, please work with if you're a family member, give the long-term care community a little bit of time, because they're hearing about this perhaps right now for the first time. Give them a little bit of time and then call them and see when you can make an appointment. And again, do that in a way where, again, you're respecting that social distancing, the masks, and staying outdoors as you get reconnected with your loved ones. And again, it's not just to protect your loved ones, but to all of their fellow residents in that facility. Of course, if you've got any reason to believe that you are sick or not feeling well, please wait or go. If you're sick, go get tested. But please wait until you're in a better shape, or again, get tested to make sure that you're negative before you begin visitation to see your loved ones. The VP3 plan phase process for indoor visitation looks at a couple of different factors, and this was shared in part on Friday, but we'll explain a little bit more now. And this is where we are going to look at the context of where the facility is located by county, as well as the prevalence in the county and the prevalence of active COVID residences. So there are two gating factors. The first is the amount of active COVID cases in the county, and we have a number of counties that have had such low prevalence that this gate has already been cleared. There are other examples, such as the prevalence in Cass County, where there is not an opportunity yet to be open for visitation and long-term care. But as I just said, even in Cass County, we would strongly encourage outdoor visitation. Again, if you can keep separate, wear a mask, have a safe physical location, make an appointment, that you're going to be able to do that while we're waiting for the indoor visitation. The second gating factor, if the first gating factor is the county, the second gating factor is whether or not there are active residents in the facilities. And as long as there are no new active residents, the facility can move to the next phase. In the first phase, which is again pre-visitation right now, if you've got a facility that's got no active residents and no active staff right now, and you're in a county that's got low prevalence, then you can start reinstitute things like communal dining and bingo and some of the important internal socialization that we know goes on in our long-term care facilities. And after you've cleared the first phase, after 14 days and another round of testing and no new positive residents, facilities can open to the inside visitation. Over 40 facilities have already had their phase 1 plan approved, which means in 14 days, they're on track within 14 days that they may be able to proceed with indoor visitation, assuming that during this period they have no new active positives with residents. If you've got an active positive with a staff member, we can remove those individuals and isolate them outside the facility, so the gating relates to active residents. We also, again, would encourage anybody who's thinking about visiting. Again, there's lots of opportunities in our state to get tested. We've got tens of thousands of kits. We've got additional capacity at the lab, and so again, we would encourage people that are thinking about visitation to consider getting tested. We are leading the nation in opening up our economy, and we are being on the aggressive side of trying to open up our long-term care, because we're trying to balance the importance of the mental health and the connection with family with the physical risks. We know how important that interaction with loved ones is on both the physical and the mental health. But of course, doing all of this would not be possible without the great testing data that we've accumulated, because we've done substantial testing around the state, and we're going to continue to evaluate how we can increase visitation. But to do that, we also have to think about how we're potentially increasing testing as well. We are kicking around some ideas about doing some pilots about testing all visitors that might come to long-term care for the indoor visits in the weeks ahead. If we've got the capacity to do that, that would be another way to make sure we're really protecting our residents. Today with us to talk a little bit about how these vulnerable protection plan reopening, the North Dakota Smart reopening for long-term care, is President and CEO of Valley Senior Living, which is a long-term care organization. They have 550 residents across all phases of skilled, basic, and assisted living, over 800 employees. They're based out of Grand Forks. As we know, Grand Forks was an early hotspot for COVID-19 cases in our state. That led to a number of employees that worked for Valley Living to be infected to the virus through household transmission, not through, they didn't get it at work, but they got it at home. This led to 6 Valley Senior Living residents who were infected with COVID. The mass testing events that we did in April gave Valley Senior Living the opportunity to transfer residents into a separate COVID care area. That helped them contain the spread and protect their residents. We want to thank Valley for their fast action and collaboration during that time. The North Dakota Department of Health testing events have identified asymptomatic employees who could stay home so they do not transmit, because again, when we've got younger healthcare workers, they can test positive, they can be transferring this deadly virus, and they may not even have any symptoms themselves. Again, why testing is important in the case of COVID. Today, there have been 3,700 tests completed for the residents and staff of Valley Senior Living communities in Grand Forks. There's going to be another 1,200 that are going to be run this weekend. Again, they've been very proactive in making sure that they're testing their residents and their staff. These tests certainly have saved lives, and it's going to allow families to reconnect with their loved ones at Valley Senior even more quickly. So today, the COVID-19 care area that they had set up is closed. Why? Because there are no current cases of residents with COVID-19 at Valley Senior Living. And since they've done that first round of testing, there have not been any additional residents infected, despite the fact that 7 additional employees tested positive during that time, which again means that Valley Senior was doing a great job of their proactive use with PPE, their infection control practices, including high discipline and high compliance related to hand washing, and also their collaboration with the state of North Dakota and local public health to make sure that there was testing done and then serial testing done to help identify and control the spread of COVID-19. Garth, I believe, is going to be on the phone. We're going to turn it over to Garth. Garth, thank you for joining us. And before you begin, let me just say on behalf of Chris Jones and myself and the North Dakota Department of Health and everyone here, thank you for being such a great partner and being such a strong advocate for the health and safety of your residents and your staff. Garth?
Thank you, Governor Burgum. And thank you for the recognition of our wonderful staff at Valley Senior Living. And thank you to the 16,000 staff across our state who are caring for just under 10,000 individuals today. They've never stopped working. They've never stopped taking extra shifts, and they're continually working beyond expectations, and they're all to be commended. Your leadership at the state level has been fantastic. And the leadership of the North Dakota Department of Health. It's been a lifeline to us to keep our residents and our staff safe at Valley Senior Living. Testing all long-term care residents has saved lives, and it will continue to save lives in North Dakota. While the pandemic is proving to be the most challenging thing we will ever face in our lifetimes in long-term care, I wake up every day thankful to be in North Dakota. First, the North Dakota legislature has provided us with the resources to have the staffing levels necessary to be successful in containing an outbreak. North Dakota has some of the highest nurse and CNA staffing ratios in the country. It's allowed us at Valley Senior Living to withstand having over 70 staff furloughed at one time when COVID-19 was at its peak in our community, and we never had to compromise the quality of care that we provide. Thank you again to the legislature for being with us every step of the way. We could not do this without your support. The North Dakota Department of Health has been amazing, and I thank them for their support throughout this pandemic. When our suppliers couldn't get us the personal protective equipment we needed, the state sent us face masks and isolation gowns so we could continue to operate under the best infection control practices possible. The consultation with the Department of Health Infection Prevention Coordinator, Faye Salzer, to implement best practices has saved lives. Since the implementation of face shields for our staff, in addition to the mass testing events, we have not had a resident test positive for COVID-19. The state laboratory has been amazing. They've been working around the clock to give us the results we need to be successful in stopping the spread of COVID-19. Thank you to the VP3 State Regional Coordinator team of Seth Fisher, Jan Camphouse, and Roseanne Schmidt for their planning and guidance for us in long-term care. When many of our peers in long-term care across the country are begging for testing, our residents at our nursing homes at Valley Senior Living are being tested this weekend for the 4th time. This aggressive testing will lead to a smart restart of long-term care, and it will allow us to reunite our residents and their families. Again, thank you to Governor Burgum, thank you to the North Dakota legislature, and thank you to the North Dakota Department of Health for your support in protecting the most vulnerable residents of our state. Finally, today's announcement of the modification of the executive order is so exciting to us, and we look forward to many wonderful reunions of our families and residents outdoors.
Thank you, Garth. Appreciate the effort of you and your team. Appreciate your words. Appreciate your leadership within the industry. And again, I want to thank you and your entire great staff for everything they've been doing to take care of everybody at Valley Senior. But I also, as you did, want to thank the over 15,000 long-term care workers in the state of North Dakota that are caring for nearly 10,000 individuals. And again, those long-term care workers, some people may have felt like their lives have been disrupted because of your work change or working from home or something, but these individuals that work in long-term care have never stopped working. They've taken extra shifts when their co-workers have had to be isolated, and they continue to be delivering great care to our seniors, and they are all to be commended and thanked today. They are truly, in many cases, acting as second families, particularly during this time frame when families have not been able to visit, and they're making sure that residents stay connected to their loved ones. They've helped them with technology. They've helped them with calls. They've done all kinds of things. So in addition to the healthcare work they're doing, they've really been providing many other supportive needs. We understand that. We know that. We recognize that, and we say thank you to all the long-term care healthcare workers in our state. You're doing incredible work to take care of our most vulnerable population, and we thank you for that. Next topic, we got an update on our court system from Chief Justice John Jensen, and I want to thank Chief Justice for his leadership through this entire time. Of course, we know that the judicial branch is a separate branch of government. They've got a whole set of operations that they need to operate and run. Our court systems, trials, and lots of things are going on across our state. And the Chief Justice presides as the Chief Justice of our 5-person Supreme Court in North Dakota, but the Chief Justice is also the Chief Administrative Officer overseeing every aspect of personnel and IT. So he's also a Chief Executive as well as a Chief Justice. And so again, Chief Justice and Chief Executive John Jensen to give us an update on all the progress on restarting our judicial system. Thank you, Chief.
Thank you, Governor. There are 3 things that I wanted to talk about today. The first was our resuming of in-person court proceedings. The second is our resuming jury trials, and then the third is I want to express some appreciation for some folks within our system that are doing a remarkable job. Just to give you an idea of the North Dakota judicial system, we handle about 180,000 to 200,000 cases a year, and we don't control the volume of our workload. Our workload is criminal filings, civil filings, which have not stopped during this pandemic. Although we've slowed down our process to addressing emergencies and to addressing vulnerable cases involving vulnerable people, our workload has continued to grow. And as it grows, the length of time to resolve cases gets longer and longer. So we, of course, as a judicial system, feel a need to get started as quickly as we can, but as safely as we can, to make sure that these delays are not going to be extremely difficult for folks, and that we can begin to resume our normal operations. As of June 1st, our courthouses and our staff in our courthouses are resuming, at least to the minimal level, to start conducting those in-person proceedings. The remainder of our staff folks will be at home working as they have during the pandemic. One of the things to keep in mind, most people may not be aware, but the courthouses that our courts are in are actually owned by the counties. The counties set the restrictions on entering. The counties also set the opening dates. So we're working with the counties to make sure that we abide by their restrictions and also their opening dates. We're also going to continue to use video conferencing, what we refer to as reliable electronic means, to conduct as many hearings as we can. Some of our hearings just simply can't be conducted by Zoom, for example. It's difficult to do a bench trial, and although possible, virtually impossible to do a jury trial. The second thing, and probably the most important thing that I wanted to discuss today, is with regard to resuming jury trials. And we've received questions on why are we resuming jury trials, because it requires pulling a number of people into the courthouse. And if you're sitting on a jury, and what most of us understand with a jury, deliberating in fairly closed areas. So I want to make sure that everyone understands that we are going to be doing that in a safe manner. Currently, for the next year, we already have 3,404 jury trials scheduled. That number will continue to grow every day. So if we don't start to begin our jury trial process, it will simply become unmanageable. So again, currently we already have 3,400 scheduled for the next year. Again, a number that's going to continue to grow. Criminal defendants have a right to a speedy trial. It's guaranteed by the North Dakota Constitution. The legislature has guaranteed that in North Dakota, and our federal Constitution also guarantees a right to a speedy trial. Some criminal defendants are currently being held in local correctional facilities waiting for trial, and we have an obligation to them to make sure that they have a speedy trial. But on the other side of the coin, the civil litigants, we also need to provide a forum for civil litigants to resolve their cases and resolve their disputes as well. I think John Adams has an appropriate quote that probably fits this pandemic pretty well, and he summarized it pretty clearly, and he says that trial by jury is at the heart and lungs of our liberty, and it kind of fits the pandemic that we're in right now. Again, the importance of having juries is they assist us in maintaining law and order among our fellow citizens. Juries decide facts while judges provide the law. And juries are really our protection for life, liberty, and our pursuit of happiness. That's the foundation of our jury trial process, both in North Dakota and federally. So what I want to do is reassure jurors that over the next month and continuing forward, you're going to start receiving a summons to appear for jury service. Let me tell you that the court system is taking measures to make sure that we can do that safely. Our unit administrators throughout the state have mapped out jury assembly areas. We've marked off our courtrooms that are compliant with CDC and North Dakota Department of Health guidelines, and we are doing that in a manner that will make sure that we keep proper distancing. We've added signage to keep that proper distancing and also to ensure a traffic flow that will cut down on people being in close proximity to each other. There will be protective equipment available at the courthouses. Judges, if necessary, will also provide instructions on both wearing masks and distancing in the courtrooms as well as in public spaces. We've worked with our county staff as well as the county staff that operate the courthouses as well as our own staff to provide additional cleaning standards during our jury trial operations. We're retaining additional bailiffs and training them on proper safety procedures, also providing them with the tools and equipment to make sure that the jury areas remain clean. We're using technology to support our social distancing. Although we have not issued guidelines on it yet, we have a committee and a work group that is looking on doing jury selection through a remote electronic means as opposed to in person. Although before we adopt any of those, we want to make sure that we are getting input from the practicing bar. We're also staggering our jury report times and calling in smaller groups of jurors during the jury selection process. We're also retaining alternative locations for larger trials. So we are taking measures to make sure that our jurors are going to be safe. One thing to keep in mind as well is that those measures have to differ based on the location. All of our county courthouses are different. They're all built differently. Some of them have very large courtrooms, others do not. We're also taking into consideration local infection rates as well as the restrictions that the counties themselves may have put on our courthouses. And we've also expressed to our judges and court staff to be mindful in granting deferment of jury service related to pandemic means. So again, the court system is being very proactive in making sure that jurors are going to be protected when they are summoned. And again, our jury trials are going to start up again beginning July 1st. And again, that means that jury summons should have started going out approximately the 1st of June. So again, please, if you receive a jury summons, know that we are going to be protecting your health while you are providing that service. I do want to take an opportunity to thank the 7,453 jurors that served last year. It's an important civic duty, and again, we appreciate what they did in 2019. I also want to take a brief opportunity to thank Justice Carruthers, who had put together a work group consisting of judges from each one of our judicial districts to work on the reliable electronic means or the video conferencing for doing our hearings remotely. I also want to thank Governor Burgum's office. They've been exceptionally responsible to our requests for information and also helping us secure or try to secure funds for those increased safety needs. And finally, I do want to express my appreciation to two specific individuals. The Clerk of Court in Grand Forks County, Rebecca Absey, as well as Judge Donald Hager in the Northeast Central Judicial District. They have done an amazing job of making sure how we can systematically look at our courthouses and take precautions to make sure people are protected during this pandemic. So, Governor, thank you for letting me provide that update.
Thank you, Chief Jensen, and Chief Jensen will be here for questions. Next topic is the Ppp Payroll Protection Plan Flexibility Act. We mentioned last week that when this had passed one of the houses in Congress, it has now passed two, and so we've got some updates on that. But before we even lead into the PPP update, we do have some positive economic news, and this is a that today was announced that 2.5 million jobs were added in our country in May, 225,000 of those in manufacturing, 312,000 of those coming back into healthcare. We know that with economic news, it's all about expectations. There was expectations and projections that the unemployment rate would hit 20%, but it's at 13.3%. So that is, as they say, a huge beat on expectations, and so very positive news there. And we know that even with those 2.5 million jobs, that's a record number of jobs created in a single month in our country. We know there's a lot of businesses that still need assistance as the economy ramps up. And today, President Trump signed the bill to ease the guidelines on the coronavirus relief loans for small businesses. So these were the Ppp Flexibility Act adds flexibility to those people that had already taken out PPP loans, if you will, and those loans can turn into grants. In North Dakota, we know that there was over 19,000 businesses in North Dakota that have PPP plans employing tens of thousands or hundreds of thousands of employees across all those businesses. But the latest version, the new Flexibility Act, triples the time allotted for small businesses and other PPP loan recipients to spend the funds and still qualify. It used to be 8 weeks, and with the tripling, I guess now it's up to 24. This almost completely assures that the businesses, if they're following these rules with extra time, will be able to turn their loan into a grant. This cuts the share of aid recipients needed. It used to be that payroll had to be 75%. Now it's down to 60%. This will allow businesses to use these for other deductible expenses, including mortgage and interest. And again, this is, I guess, definitely more than tripling. Now it says here that businesses can use the money for 6 months instead of 2 months. That's the tripling. I guess that it was 8 weeks to 24 weeks is where they got this 2 months to 6 months is a similar math. This will extend a June 30th deadline for companies that had to rehire by June 30th. That moves that out further, gives them more time to get people back on, and if the loan does become a loan, it will give loan recipients longer time to pay it back. And it also allows companies receiving loan forgiveness to defer payroll taxes in some cases. If you have not applied for PPP funding and you say this sounds amazing, you still have until June 30th to submit an application. There still is some money if you have not yet received it and you apply for that application. You can learn more through the ndresponse.gov under the business section there. Bank in North Dakota, I'm sure, has got information on their website. And also, again, contact your local banker, because all these PPP loans are done through the local banking relationship. But if you want more details on this, there is going to be a special business briefing. I think we got a slide on that coming up. And this is scheduled for Thursday, June 18th at 9 a.m., hosted by the Greater North Dakota Chamber, but there'll be speakers on there from I'm sure the Bank of North Dakota, the banking industry, from the Department of Commerce will help lead that. And again, if you want to have, you can get more registration details to reserve your spot under ndresponse.gov under the Business and Employers section. But tune in to that. Great news for all businesses in North Dakota. On the behavioral health update, we know that the pandemic's caused stress for many North Dakotans, and we know that behavioral health is important, is as vital to overall health and wellness as physical health, and supportive services from trained crisis counselors can help individuals identify and understand emotions and connect to resources. And we know this, that behavioral health matters. That's why every single program we've included a short segment on that. Today we want to talk about the behavioral health team is launching Project Renew. This is a partnership between the state of North Dakota and the behavioral health team with Lutheran Social Services of North Dakota, or LSS, and this will provide free and anonymous support services to individuals throughout the state who are impacted by COVID-19. Project Renew is made possible in part thanks to a recently awarded Crisis Counseling Program grant, which was received from the Federal Emergency Management Agency, or FEMA. Project Renew services include supporting community members in understanding their physical and emotional reactions to COVID-19, developing and improving coping strategies, reviewing options, and connecting with other individuals and agencies that may be of assistance. And we know that for some folks, the combination of the economic stress and the pandemic put people in some really tough positions. They may not feel that there's a way out of those, but if you, this is an opportunity for people through Project Renew to set a new baseline, go forward, and reconnect. So in addition to offering these community support services, Project Renew initiative will provide outreach to those impacted by COVID-19. There will be a website that's coming up at projectrenew.nd.gov, serves as a comprehensive resource for information on coping and well-being, wellness tips, and who to call if you're in a true crisis situation. And the Project Renew hotline can be reached 701-223-1510 from 8 a.m. to 5 p.m. Monday through Friday, that's Central Time, and individuals can also send an email to renew@lss.nd.org. Thank you, Behavioral Health Team, for pursuing and getting that FEMA grant, and thanks for setting up Project Renew. Pandemic EBT food assistance extension. EBT, of course, is electronic benefits transfer. This comes through the SNAP program, which is a supplemental nutritional assistance program. But preventing hunger during this pandemic remains a top priority as the North Dakota Smart Restart progresses and economic activity continues to grow. And especially to ensure that children do not go hungry, we've extended the pandemic electronic benefit transfer through June 15th beyond the original deadline of application was May 31st. So again, still time to apply, another 10 days for the Pandemic EBT program. The Pandemic EBT program offers food assistance to families with children who've participated in free or reduced cost meals in our K-12 system this past year. This food assistance has been distributed to reached its way to 3 out of 4 qualifying North Dakota children and families who have already received this extra help, include those who participated in the SNAP program. We appreciate Team ND members from the Department of Public Instruction, Department of Human Services, who created this program with support from the USDA and who continue to work with support from local schools to connect families with this food assistance. Parents, if your child's school contacted you with information about applying for the Pandemic EBT, then again, know that you now have an extension. You've got till June 15th to apply. If you think you're eligible, please do. Applications can be completed online at nd.gov/DHS info COVID-19 families. If you're unable to complete the online application, just contact your child's school for an application. You can also contact the Department of Human Services Economic Assistance Division at snap-pebt@nd.gov, or you can call the Human Services Department 701-238-2332 with questions. To date, we've provided about $8.4 million in extra grocery buying power that have benefited 29,900 North Dakota children. And we know that there are families out there that can still benefit who may not have applied. So again, please take this opportunity with this extension to June 15th to apply. And again, thanks to everybody who pulled that together. And as we close on a couple of topics, first is on gratitude. Lots of people have been doing incredible work during the pandemic. You all know that. But one group we want to give a special shout out to is the 32 hotline heroes, as they go by, which are those people that work our health department hotline. They've taken over 15,000 calls since March 12th, and questions come in like you, I'm sure, can't even imagine. Sometimes they don't have simple answers, but they begin their pursuit of answers, and all of this research and fact check, whether it's chasing down rumors, but making sure that, again, North Dakotans have got all the best facts to help navigate through this time. Many time, questions the operators are answering are simply centered around the hot topics of the week, whether it's a smart restart or how to find a testing site, but they also field questions about rumors, misinformation that someone may have read online, or interacting with individuals who during this pandemic sometimes just wanted to share their concerns. And so these hotline heroes have provided a listening ear, whether it be surrounding the loss of a job or the loss of a loved one. A common sentiment from the hotline operators is that when they're working with the public, it feels like one united North Dakota, that we're truly all in this together. In one situation recently, one of the hotline heroes, Sherry Kiefer, took a call from a woman who was COVID positive and was developing extreme shortness of breath. Sherry was able to get her name and number before she lost contact with her. Sherry quickly went to work to ensure that emergency services were notified. An ambulance was deployed to the woman's home. And as a follow-up, the health department and disease control was able to verify that the woman was taken to the hospital, was treated. It's a powerful story to illustrate the impact that the hotline has made and the hotline heroes have made on the lives of North Dakota. After more than 12 weeks of excellent work from our hotline team members, the hotline heroes, the traffic is lessening, so beginning tomorrow, we're going to shorten some of those hours again. The hotline will be available back now 8 a.m. to 5 p.m. Monday through Saturday by calling 1-866-207-2888. Again, we want to thank you to the hotline heroes for the impressive work you've done. Thanks for your great work and metrics in terms of how quickly, how short the wait times have been and how quickly you've been responding. But again, you're doing great work. Thank you, hotline heroes. Next topic has to do with the demonstrations. In North Dakota and across the United States and around the world, people are mourning the loss of George Floyd and appropriately demanding change, justice, and equality. And they're doing that in peaceful marches and sit-ins and in rallies. And today in Fargo, there was thousands of peaceful protesters gathered to celebrate the life of George Floyd and continue a constructive dialogue to foster understanding and create change with compassion, inclusivity, and justice for all. Working together, the organizers and city leaders earlier this week began sitting down and visiting with each other and listening to the concerns that they have had about equality and justice in the community and how policing might be done or done better. So there's been a great exchange by both sides, and I know that the mayors of all three communities in the FM metro area, along with the police leaders and the Cass County Sheriff and the Cass County leaders, are listening to ensure that the feelings and the experiences and the voices of all North Dakotans are heard and respected. Since the death of George Floyd, historical scars and current frustrations, and perhaps for some generations or centuries of concern have been essentially laid brutally bare in many of our communities across the United States. The anger, the pain, the frustration of many citizens is evidence, and at times those emotions have boiled over into displays of violence and destruction. And while those displays of violence and destruction that are unlawful and unacceptable, and they do take away from the underlying concerns, legitimate concerns that these protesters are voicing, we just have to make sure that we cannot and do not allow that the violence overtakes the perception of what has been largely a peaceful movement for recognition and change. We know this whether it was in Fargo last Saturday night or around the country. We know that scenes of violence and vandalism are hard to stop looking at if and they make for great headlines. But we need to understand that for every person that has picked up a rock and thrown it, there are probably 1,000 or more that have remained peaceful and in their hearts just desire what we all seek in this country, which is liberty and justice for all. In North Dakota, again, we've been so many reasons to be grateful to be North Dakotans, but in this past week, thousands of North Dakota have shown up in Fargo and Minot and Bismarck, Dickinson, Williston, and Grand Forks, where all have hosted peaceful demonstrations. We've had North Dakotans stand shoulder to shoulder as neighbors in gaining understanding from each other about their concerns and their aspirations. We will continue to fight fiercely to protect every citizen's right to peacefully and lawfully assemble and to protest, because those are American rights. We also encourage people, as you're protesting, to bring with you the humility and the curiosity to truly learn and understand each other. And again, coming out of this, we must all together have the courage to remember and to do better and to be better. We are fortunate that North Dakota, that we've had little of the violence that we've seen in other communities and states across the nation, and that's a tribute to all of you. It's a tribute to our citizens, to our local leaders, to law enforcement who are leading with peace and understanding and outreach and have made this possible. I want to give a specific shout out to in many of our cities, there's community resource officers that work as part of our police departments, and these are often embedded with the youth in the K-12 systems around our state, and they have really built personal relationships with people across our state. And again, I know that they're an important voice here, and I want to thank all of those community resource officers. And to those that are protesting, we want to say what we've said before. We hear you. We see you, we're listening to you, and as always, we stand ready to work together to make our great state an even better place to live. And a closing quote today from a 57-year-old author, Martha Beck. This is a quote that makes me grateful for curious people because when we come together, we might be meeting people for the first time. When I stood on the street last Saturday or Sunday morning, just hours after the protest had ended in Fargo, and hundreds of North Dakotans had come together to sweep up glass and work together, and they were there because they cared about their community, they cared about their neighbors, they cared about the reputation of our state, and they cared because they believe. Some of the people I spoke to had moved to North Dakota from other states because they wanted to get away from the violence and the mistrust and the misunderstanding that perhaps they thought they were leaving behind. And as we had those conversations, I saw people, showing real appreciation and genuine curiosity. And that's Martha Beck's quote: when you meet people, show real appreciation, then genuine curiosity. So as we bring our emotion and we bring our frustration, we bring our anger, let's also be grateful to those who bring their curiosity to learn, to really truly understand what it's like to be in another person's shoes and understand from where they're coming from. And so again, as we maintain this curiosity, as we maintain as leaders our humility to understand that what we're going through right now, the trifecta of a global pandemic, a economic crisis, and global civil unrest. When we go that, we have to have the humility to know that leaders haven't been through this combination before simultaneously, and we need to bring our humility and our curiosity into these conversations. So we understand that there were some of those conversations were happening today as the mayors and the protesters all shared the stage and shared remarks, and the mood was hopeful, and let's hope that it can stay that way through the weekend as we all gain a better understanding of each other and as we all seek to build the country we know we can, where there is liberty and justice for all, which means everyone. With that, we'll stand for questions. I want to remind people that we've got Chief Justice Jensen here and also Chris Jones, and either one will be able to answer questions about their topics. We're going with Jack Dura first.
I just have two quick questions. These plans for the long-term care facilities, those have to be approved by the state, and what is the grant amount from FEMA for Project Renew?
Well, I'm answering the first question. I'll help somebody else come up with the grant amount from FEMA for me, because I don't believe I got that right here offhand. The answer is yes. Plans have to be approved. And this isn't about state control. This is about partnership. We've got a senior team. Chris has got a great group. He can come up here and speak about those individuals that are on this, but I would just say as he's making a step up here to say that each facility is different. Some facilities have got long-term care, basic care, and skilled nursing all in the same facility. Some of these are separate. Some have got courtyards, some don't. Some have got more flexibility in terms of how they've been able to isolate. Some have got, community rooms that could be repurposed for appropriate social distancing. And so the key here is for us to try to be, when we say approving the plan, we're not doing that from a standpoint of control. We're doing that from a standpoint of how can we help each of these 218 facilities safely reopen as quickly as possible. That's the goal that we're trying to get to, and that's going to take a combination of testing, and it's going to take local leadership at the building and site and the corporate level to make sure that we're taking advantage of all the assets they have, and that we can be as flexible as we possibly can, well, in terms of helping them get through the two gates, but do that while we're still holding fast to the criteria that we've placed, because we know that that criteria is going to help us protect those residents in those facilities who today, largely across the state, are negative. I mean, because of the great work that we've done, we're down to very few cases inside of long-term care across the state. I went through the numbers. We know how deadly it can be for people in their 70s and 80s and older. And the last thing we want to do is to come through this thing with such success is open up in a way where suddenly we find ourselves with a mass outbreak at a facility. That would be devastating to all of us. But Chris, you want to talk a little bit about your team and how we're going to improve plans?
Thank you, Governor. He did an excellent job of describing the vision of the VP3, and just want to emphasize this isn't a regulatory or license. This is a partnership and working together. And in order to do that, we did bring on Roseanne Schmidt, who was a previous chief nursing officer for St. Alexis and Bismarck, as well as a long-term care nursing home administrator. So has excellent background in both those areas. Jan Kamphaus, who is a retired chief nursing officer for Sanford, as well as Seth Fisher, who was the DON, Director of Nursing for the nursing home in Beulah as well. So they're the ones working together, working with all of the long-term care facilities to try and find a way to balance the risk of infection up against how do we make sure that people can see their loved ones and remain safe. The other key addition to the team from a part-time basis is Dr. Andrew Stahl, who joined, as you know, last week, and using him as background for the clinical information. So this is a new disease, but we have to follow clinical information, but also understand the operations of long-term care facility in order to make this best for everyone.
Just a quick question, Chris. Let's say a long-term care facility has had these modified visitation policies in for a week or 2 weeks, and then a positive case comes up between either a resident or a worker. Do they go straight back to phase one and have to come up with that new plan, or can they just submit the same plan from before?
One point of clarification, you only go backwards if a resident is positive, because we can isolate the healthcare worker. So only as you go through the gates, if a resident becomes positive, do you go back. Typically the plan will still be the same as it was before, but we will go back in and work with that facility to try to isolate what happened and work with them again.
A couple of just probably yes or no questions, I think. So outdoor visitation, that's something that every nursing home in the state can do right now?
Yes, as long as they work with their local community, their local facility, practice social distancing, do all of the other universal control, and do it by appointment.
And
masks.
Right, okay. In phase one here, that's two components. That's a number of active cases in the county and active cases in facility, right? Mm-hmm. Okay. Facilities have passed that level now, and then the next phase would be this 14 days and then maybe allowing indoor visitation after that, right?
Yes.
I'm just wondering how many counties would meet the threshold for active cases, if you know that? or what is the threshold might be a simpler question, I suppose.
I will have to look at the number, but it's based on per capita, percent of active per capita cases. And there is a website that we'll have posted out on Smart Restart or ND Response, as well as on the DHS homepage as well.
And then I guess my last question for you, is there a point where you guys are thinking about family members being able to take residents outside of the facility to a restaurant or something like that?
Yes, so even today, family members can, if a resident wants to leave, we cannot keep them in the facility. However, if they do leave, then they still have to follow the quarantine restrictions that were in place previously. Thanks.
And Jack, your question, $160,000 for Project Renew, that was the FEMA grant, lasts for 45 days. The Department of Behavioral Health will have an opportunity to apply for more funding to extend to 9 months in total. Dave Thompson.
Chief Justice.
Excellent, thank you. Way to go, Dave.
Mr. Chief Justice, thinking about the stereotypical jury box, 12 people in fairly close quarters. If you're having a jury trial of 12, is the jury going to be spread out throughout the courtroom?
We're going to use, actually, that's a good assumption, because we're going to use the courtroom itself for where the jurors are going to be. We're also expanding some of the jury boxes. And of course, misdemeanor jury trials 6 and civil jury trials 6 or 9. So, but good assumption. We're using all of the space that we have.
Will visitors then be limited in terms of?
What we're going to do is cordon off that part of the courtroom. Public trials are important. It's constitutionally we have to assure that we're going to have public trials. So we're going to make sure we have accommodations for the public as well.
What have you heard? What have you heard from litigants and attorneys in terms of how you've had to do it up until this point, using electronics, using probably Zooms and things like that?
You know, the feedback has been exceptionally positive. In fact, going forward, once we're out of the pandemic, I think we're going to see a lot more use of our reliable electronic means, particularly in civil cases where short, very concise hearings could be held by reliable electronic means rather than having somebody drive from Grand Forks and Fargo to Williston or from Williston to Fargo. Additionally, another area specifically that I'm thinking of is guardianship proceedings, where we do the legislature has requested and required us to now do annual reviews. And those annual reviews, oftentimes the guardians are out of state. They're relatively short hearings. Doing those by reliable electronic means is fantastic. Yeah.
So I just had a question. You mentioned that jury trials are going to start on July 1st, but you also noted that the courthouses are in the control of the counties, and that some of them may not open. Is there a chance that parts of the state won't have jury trials on July 1st?
That's possible. Our anticipation is, though, that all of the courthouses will be open in some form that will allow us to conduct jury trials by July 1st.
One more question. You mentioned there could be a deferment based on pandemic-related reasons. I'm wondering, would that apply to somebody who has underlying conditions or somebody who doesn't feel safe, going out in public?
The answer to that is yes, and that's in 2 steps. Currently, we do a screening because the counties are doing screenings at all of our high-traffic courthouses, so that the CDC guidelines are the questions that are normally asked. We're also circulating for public comment a questionnaire that would allow kind of pre-identification. That's being done now by calls to the clerk's office, and it's also being done individually by the districts, but we are circulating a questionnaire that will have a uniform. We wanted to send that out for public comment, though, because you are entitled to a jury of your peers, and what we don't want to do is begin excluding people from jury service categorically. There are some people with underlying conditions that may feel comfortable serving. And so we want to make sure that they have the opportunity to do that.
Just a number check, Mr. Chief Justice. More than 7,400 people served on juries last year?
Yes. It was 7,453. Yeah.
That would almost be 1% of the people in North Dakota. So as you can see, the scope and breadth of everything that the chief has to deal with and the scope in our justice system is large and complex and in great hands. Thank you, Chief. We will go to online for questions.
I don't currently have any.
Is the line down? We've lost our connection. This is a first. Friday afternoon in the rest of North Dakota. I'm literally stunned. I can't believe that. Usually we've got a backlog of online questions, but Lane's ready for a question.
Last week we saw the threat level index used. Was wondering, since then, have anybody shown their concerns as being confused by it or maybe even mistaking it as the fire danger index? And do people seem to understand how that works?
Haven't seen any confusion with the fire index that at least that's reached me. I think that it's got good clarity. We can always do more. You folks have done a great job here of helping us get the word out. I think that people really have seen it, of course, when we made those steps to move to the next level. 75% occupancy at restaurants was probably one of the things that people felt immediately. Going up to the larger group size, 500 people felt that. We know a lot of people they're holding weddings. We hear weddings that were going to be planned for Minnesota that are moving to North Dakota. We're hearing that a lot. So we think there's been for the folks that it matters to, everybody's got it figured out, and we'll try not to create any confusion when we have the chart that was being asked here about which counties both on ND Response and on the DHS website. We will, as we go forward here with the long-term care, we'll have a separate map for long-term care which will show the county status. So there'll be one map for the North Dakota Smart Restart for businesses. There'll be another map for long-term care which will show which counties have crossed the gating threshold. And so we'll try to do that without creating confusion about fire danger with two different maps. See if we can get that done. But it's about trying to save lives and livelihoods. We want to be moving ahead as fast as we can with the economy, at the same time protecting the 10,000 plus folks that are at real risk from this. Dave?
Governor, do you have any idea how many jobs are open in the state of North Dakota right now?
We know that our estimate going into this back in March was about 30,000, and that was a list of the ones that we had at job service, which was always been floating between 14 and 15,000 that were listed. But from our survey of employers, say if you were a healthcare organization and you needed 100 nurses, you wouldn't post 100 positions. You might post 5 for the different types of nurses you need. And same if you were welders, if you needed 50, you'd post some people would post one position and then just keep it posted. So we knew that there was more demand than there were positions. As I've said, I don't think we're going to really know what this is until we get through the end of the extra $600 of the federal unemployment, because again, we're still in this inversion period where even as businesses are looking for workers to come back to work, in some places there's an inversion where you can make more money on unemployment than you can in the workforce. I don't think that's a good. It is the program that it is. I don't think it's good for the country, good for the economy, for people to get paid more for not doing something than being a constructive part of the economy, because I think work's got benefit in of itself. But that's a personal opinion. But I just think. People are smart, and I think that we'll see more people getting back into the workforce when those extra dollars run out. We now have one online. The connection is up and live. Okay.
Jean Schemp, Hometown Radio Group. Since contact tracers follow the symptoms of each positive case, can the state tell us of all the people who have no symptoms when they test positive, how many go on to develop symptoms? And if that is a statistic we're keeping, or if that's not a statistic we're keeping, could we begin tracking that?
I don't know the answer to that question, Gene, if we are tracking that specific thing about people who we know. We do track who's asymptomatic and who's not. I have not seen an analysis of people who started out asymptomatic who became symptomatic, but that's a good question to ask. Thanks for coming in with that. I would share on a question on contact tracing, this was one Gene asked, but of the over 10,000 people that have been involved in contact tracing, so roughly 4 to 5 individuals for every individual who's tested positive. The contact tracers have reached out to them, and I think I saw in a report today that right now we've got capacity, we've got about 250 people trained, there's about 165 people that are working at least part of their day as a contact tracer. They've contacted over 10,000, and I think 4,400 of those individuals have been people who work in healthcare. So again, when you get someone who's test positive, it seems, intuitive. They'd say, well, who have you been in contact with since you're positive? Well, if you were sick, you might have, gone to a clinic, you might have got a test, you might have been involved in a medical procedure. So a lot of the folks that end up being exposed to positives are people that work in healthcare. Okay. I don't see any other questions coming up. I do want to close with on a lighter note for Dave Thompson. We talk a lot about testing and how to get our testing numbers up on weekends. So there is a serious consideration about how we do this. The 3 ideas I'll float out. You'll hear more about these next week. One of these ideas is using some of our testing capacity to test people that want to do indoor visits at long-term care facilities, because we know there's a lot of people that would raise their hand and say, wow, if I can jump this gating period and I can go visit my loved one if I've tested negative within the last 24 hours, if we can do that, I think we'd have a lot of demand for testing and a lot of people that would want to get together. And if we had people that if we could somehow do effective large-scale point of contact testing, we could connect people together and do that and eliminate most of the risk for the residents we're working to protect. So that's one. The other is we know that when you just take a look at our cases, the vast number of our cases, it tracks a little bit with population, but a lot of the cases were people in their 20s and 30s and 30s to 40s, which are people that are more likely to be going out and about, and a number of them are asymptomatic. And so one of the outreach programs we're considering, we know some other states are, is how to do this. It could be coming as part of large events, but it also could be, we may find that there are some bars and restaurants that are interested in participating in some testing events. And then the last one, this is for Dave, is when we were trying to think about how do we get our testing up on Sundays when people tend not to test. There's going to be some outreach to faith-based organizations that may want to participate. If people want to, coming together in greater densities, maybe there's an opportunity to partner and do some surveillance testing on Sunday with those that are attending church. And for Dave, I wanted him to know that we are going to call that our mass testing. Okay, that's the final word for today. Okay, all right. With that, thank you all. Thank you, Chief. Thank you, Chris Jones. Thank you, Lindsay. And we'll see you next week. Tuesday is Election Day, as everybody here knows. We know this group will be very busy. So we'll see you next Wednesday at, what time, Mike? 3:30? 3:30 next Wednesday. We'll see you again. Have a great weekend. Be North Dakota smart, stay healthy, and to all the protesters, thanks for staying peaceful. We hear you. Let's keep them peaceful, and let's keep working towards the future together. Thank you.